And what you can expect to hear today. So, for today's agenda, we're going to discuss the importance of community partnerships in supporting health information for migrant workers. We're also going to discuss ideas on how health science librarians and libraries can support migrant farm workers. And lastly, we're going to discuss future needs in migrant and seasonal farm worker population. So I want to introduce our speaker today. We have presenting for us Jamie Bloss. She is a librarian, associate professor at the Lampus, is it Lapis? I'm sorry, Lapis Health Sciences Library and liaison to the College of Allied Health and Sciences and School of Dental Medicine at East Carolina University. She also teaches online undergraduate information literacy courses, an adjunct professor for Kent State in Ohio, and also worked as an emerging technology librarian at a public library and as an academic librarian also at the University of the South Pacific in Fiji before she settled on being at Eastern Carolina University in Eastern North Carolina. Her interests include teaching information literacy and digital skills, evidence-based searching, and helping to reduce the health disparities of the digital divide for migrant and seasonal farm workers and their families. She also participates in a number of research interests and conducts research at her university. And she hails from Cleveland, Ohio, and is currently living in Farmville, North Carolina for us today. So thank you so much, Jamie, for joining us. I'm going to go ahead and stop sharing so that you can start. And I'm going to pop a poll in the chat for everyone that Jamie's going to go ahead and get us started with. I'm also going to turn off my video so that you guys can focus on Jamie. So thank you so much, Jamie.
Yeah, thank you, Faith, so much for that introduction. I have just activated this poll for you all, so I just wanted to get a sense and a feeling for how many folks have engaged with maybe the farm worker community or even other groups in rural or agricultural communities. So that question, if you want to use the link, it's pollev.com. That's the easiest way to get to it, I think, rather than the texting. So if you'd like to go ahead and answer that poll, and I'll just give you a minute or two for that. Excellent. So it looks like we have a lot of folks who have been doing outreach, but not necessarily with farm worker population, but we do have some folks who have done outreach already with either rural or agricultural areas, and a small number of you who have done some outreach with farm workers. So that's excellent. So that gives me a good indication of where we're at today. So I'm going to go ahead and close the poll at this time and go over to my slides. So here we go. All right. So as Faith said, today we're going to talk about outreach to the migrant farm worker community, which is, I think, an often overlooked population. It certainly wasn't one that was very much on my radar before I became involved with some of the grant work we've been doing at Lapis Library and at ECU. And then also just give some general tips and things on how you can form community partnerships or strengthen those partnerships, and also just ways that you can get involved with this population if it's something that you're interested in. So I wanted to start just by giving some brief demographics of the farm worker community. The NAWS survey, which is the National Agricultural Workers Survey, is where I've gotten this information from. So they do this every couple of years. And there's about 3 million farm workers in the United States. And just to clarify too, when I talk about farm workers, I'm not talking about the growers, the producers, the farmers who own the land. I'm talking about the people who work on the land and pick the crops and do things like of that nature. So the demographics of the group, about 66% of farm workers in the US working here are men and average age of 39 years. 78% of them identified as Hispanic or Latino, and 66% actually self-described their race with the open-ended other response, which I thought was pretty cool and interesting. 33% are white, 10% are consider themselves indigenous, and fewer than 1% of farm workers are Black or African American. Over half of them had some kind of work authorization. And so there still is a large group of undocumented folks who are here working in the US, doing this really important work. And the median personal income is about $20,000 to $24,000 a year. The average educational attainment, which is really important when we're talking about health information, is ninth grade. So that's important to keep in mind with creating or distributing any health information, is that it's about an ninth grade level, but maybe even let's make it a little bit more, even less than that for the literacy level. And then 38% of farm workers are also who were surveyed were living away from their immediate family when they were interviewed. So that's also something that comes up, is just mental health considerations and the fact that many people are working far away from their families. So this is a quote from a 1945 report from a US Public Health Service doctor who wrote that migrants are people, they deserve a chance to live in decent housing, to feed and educate their children, to get needed health care for their families. The lessons of experience must be translated into a really effective long-term program of health and welfare for our migrant farm families. And as of yet, there are certainly programs, outreach workers, and health services that are working to help with health disparities with this group of people. But unfortunately, we haven't seen so much change since 1945. Some of the things that farm workers still experience widely to this day are some non-communicable diseases such as diabetes and hypertension, and then certainly some communicable diseases, STIs, things of that nature. And then, of course, workplace-related issues like pesticide poisoning, and this goes for their families as well, not just the people who are working in the field. Low back pain and musculoskeletal injuries, extreme temperatures, certainly where I stay in North Carolina, it's very intense. And you also have to wear long sleeves to cover up from the pesticides, and gloves and things like that for safety, but then also wearing a hat to protect you from the sun. There's certain crop specific sources of risk for all different types of crops. For the folks who work with tobacco here in North Carolina and other states that would work with that, they can be exposed to, from the tobacco, they can get basically toxicity from the green tobacco and have different issues from that. And in general, just the access is a little bit limited. They may not have access to their own transportation or transport to go to a health clinic. And it's really difficult for them to take time off work. They work really long hours, like getting up at like 4 or 5 in the morning and then getting off work in the evening after the sun has gone down. And then certainly with the housing, and I'm not saying that this is the case in all cases that the housing is still hazardous, but a lot of the housing is just kind of really basic, like, maybe a trailer or just some kind of outbuilding. It's usually off the road where you can't really see it that well. And I don't have photos in this presentation, but there's certainly not super well equipped housing most of the time. And then, especially with COVID, they don't have always access to hand washing stations or things like that that can help prevent the spread of illness. So basically, in some places, not a lot has changed for a really long time. So I want to show this video though to you all of farm workers sharing their stories, some of their motivations for why they come and work in the US, because I think it's really important to hear from their voice and not just me telling you about all these health disparities that they experience. So we'll pop over here. And please let me know if you have any trouble hearing the video.
Confirmed we can hear. Thank you.
Great. All right, so that video was produced by Student Action with Farm Workers. They're one of the groups that we've worked with as a community partner. They do internships with college students, and one of the things that the students do is they create a lot of documentary film work. So that was one of the things that they've produced. So I wanted to tell a little bit about my background and how I got involved with working with these community partners. So first, when I was in graduate school for my MLIS degree, I interned at a hospital library, and that really got me interested in medical librarianship. But then I had a little bit of a departure. I've worked at a very rural university campus, the Kent State Geauga campus back in Ohio. Then I worked at a public library, and then I moved to Fiji for 3 years and worked at their university library there at the University of the South Pacific. And then after that, I decided my husband and I wanted to move closer to home because it's pretty hard to visit Ohio from Fiji. So we moved back to the States in 2019 and got hired down here, finally making my journey back to medical librarianship. So, but growing up in Ohio, my grandparents are from a rural area, so I'm happy in that I get to give back to these communities now later on in a very serendipitous sort of way. And how I got involved with this grant was some colleagues at ECU and another librarian had written a National Libraries of Medicine grant to address health disparities with farm workers. And one of those colleagues was going over to the College of Nursing because she also has a PhD in nursing. So she asked if I wanted to get involved. And just because I seemed like helping people, and I was like, I do. Um, so she co-wrote the grant, and then for me, I just got to get on board and start doing the work, which was great for me. I also studied Spanish, minored in it for my undergrad degree, so that was really exciting for me to get to use that in some way. And I was certainly apprehensive because reading over the grant narrative and everything that we promised that we were gonna be doing was a huge amount of work. And I didn't even know much about the population of folks that we were gonna be working with yet. But I said I wanted to do it. So a lot of this talk is just my experience with that grant, and then tips for engaging with community partners based on that experience. So it was a 3-year grant, and one of the major things that we wanted to do was identify health information that's designed for farm workers, and then eventually have the folks that created those materials submit them to the Health Reach database. And I'll explain how all of these things actually went in a minute. We also wanted to increase knowledge of the National Library of Medicine resources like medlineplus.gov and those things for the outreach workers who go out there and do education and health outreach with the farm worker community. We also wanted to get technology into the hands of those outreach workers and offer professional development opportunities for the outreach workers. And then the last aim was much more related to internet access because that remains a very much an ongoing issue in the rural areas around North Carolina and especially for farm workers. So we also worked with some community partners to do digital literacy and health literacy training, and then also provide hotspots in the migrant labor camps. So our partners that worked on this main grant was the ECU Department of Health and Human Promotion. They really oversaw the whole grant. We had a social scientist involved to do the evaluation of the grant. And the library part was really helping with the collection of the health education materials. We also partnered with the NC State Extension Toxicology Program, so we had a science educator on board as well. So when we did focus groups and distributed technology to those outreach workers, they were very heavily involved with that aspect. We also partnered, our third partner was Student Action with Farm Workers, so they were really essential in liaising with many different groups of community partners to install and then work with maintaining those internet access points in the migrant labor camps. And then myself, the librarian, I was really involved across all 3 aims with training aspects, collecting and organizing the health education materials that we found, helping with the research projects, and then creating videos and other educational sources. And before I go further, I just wanted to talk a little bit about who are outreach workers, CHWs, or community health workers, or promotores. I'm going to kind of use those terms interchangeably. But they assist their community members that really help assist bridge the gap to bring migrant workers to health and social services. And they also do health education. So they work with health providers to then get reliable information and then bring that out to the farm worker community. They also help with transportation to doctor's appointments. And the reason that they're so distinct from other health workers is that they don't really have formal training. There's no kind of formal training program at this time to become a community health worker, but they're from the community that they serve. They're trusted members of the community, and they help bridge that gap between the clinicians and the population that they're trying to reach. There's approximately 60 of these folks who work across North Carolina in each season, and they do a lot of it with no internet connection. They do a lot of outreach and education to the groups just verbally or by using visual aids like flip charts, which I'll talk about a little bit in the future of the presentation. And so, and we'll make sure you have the slides to this. This is just a little bit more information about our whole team. And we also had an advisory panel, and I wanted to highlight the importance with doing any kind of grant work or outreach work of having an advisory panel. So we had folks on our panel. We had other librarians, we had other researchers, we had community health workers, and we also had student members who were the children of migrant or seasonal farm worker families. So we had a lot of input on them with anything that we were developing with, and that was very helpful with the educational videos that we created to have their input. So I've got one more question that kind of ends the first little part of the presentation. So if you'd like, we're going to do a word cloud. So I'll go ahead and activate that. It's the same exact link you used for the first one. And if you would like to name one organization or group you already partner with or would like to reach out to in your community. So I'll give you a little bit of time to fill that out. Just to try to start thinking about who you might want to partner with in the future. Very cool. So we have a lot of different ideas there, different organizations, it looks like, and some different groups of people, migrants, seniors, rural areas, folks with infertility or infertility centers. That's excellent. So it looks like there's a lot of brainstorming happening on who you could reach out to in the future. All right, I'm going to go ahead and exit this poll for now. And I can hopefully maybe send this out as well after the presentation. So for the second part of the presentation, I wanted to talk a little bit about how the aims actually went. You saw kind of our big overarching goals and everything. So one of the things that we were kind of most proud of was with the aim one of the grant. I searched through many different websites, Farm Worker Health Program, the NC Farm Worker Health Program, Migrant Clinicians Network, a ton of different websites to try to pull materials off of those and basically loosely, not really cataloging, but very loosely just categorizing them by the topics, saving information, saving the URLs. We didn't actually, unless we had permission, we did save some of the PDF files, but for some of the materials, obviously, we didn't have permission. So we were just linking people out to those resources. We also sent out like mailing envelopes that were pre-stamped and everything so that people could send us copies of materials that they were already using for health outreach to farm workers. And then we also sent out some information on listservs as well to ask people, what materials are you using for health education? And when all that was said and done, we had over 700 materials. And what we did is we basically organized them by topic. The documents in English and Spanish, and you can go to a topic, like you could look up green tobacco sickness or heat exhaustion, and you can go and you can find all those materials listed by topic. So we did this really for the outreach workers because they had said in focus groups that they use the same materials over and over again. So this was a way for them to see what else is out there and get access to other health education materials. We also completed a mapping review of farm worker health research. This is kind of just an additional research project we wanted to take on. And even looking at all the big databases that you would use for a mapping review, PubMed, CINAHL, Agricola, Lilac, Scopus, there were only about 1,000 articles, and we put no time limit on that. And those were 1,000 articles about farm worker health. So I know 1,000 sounds like a lot, but if you're doing reviews and scoping reviews and things like that, and this is on all health topics or research with farm workers. So we then categorized those articles in case people are interested in that and created bibliographies based on those health topics as well. One of our main goals had been to submit a lot of these health materials or get those content creators to submit their health education materials to HealthReach, but that had been discontinued. So we kind of just did what we could if we were able to get permission from different people and put those PDFs up onto our UNC Dataverse. We did that for the ones that we could get permission of. We also did a content analysis of 4 different websites that's going to be published soon to see what number of those materials, like say on Migrant Clinicians Network that were linked there, how many of them were actually tailored to migrant workers, because a lot of the materials we ended up seeing, for example, on diabetes or hypertension, they weren't actually tailored to the farm worker community with the content, literacy levels, things like that. So that's coming out soon. And what we found is that a lot of the health education materials that are being used with farm worker populations are not really tailored for them specifically. And then lastly, something really cool that came out of the AIM one is that we then made connections with Wake Forest University and NC State, and we're able to actually create an archive of physical materials that's in our archive now at Lapis. Because once we had gotten all these materials from different outreach workers and researchers, it was just sitting in my office. So we collect materials in our archives on the history of Lapis Library and on medical education in North Carolina. So we were able to create, work with the archivist and create a new collection. So that was a really cool and unexpected outcome for me of working on this project. So there's just so many things that you can do and areas that still need addressed after all of this. I'm going to go kind of quickly through the next aims, but for our second aim of the GO8 grant, the NLM grant, 3 focus groups were completed with health outreach workers to find out what technology and things do they really need, what kind of topics do they need more health education materials on. And so they found out some very interesting things. Some of the outreach workers really wanted megaphones just so that they could speak louder and talk to the farm workers where they live. Some people wanted tablets. Some folks wanted a TV or a projector so that they could do their presentations. A few people wanted like a PA system with a microphone to speak to the farm workers, or tripods. We also ended up doing some educational video on how to use TikTok for health education, and so we were also able to buy ring lights and tripods for folks. So because of the pandemic, we held a bunch of different webinars. I was just heavily involved with how to search for reliable health information online, but we also did some on using Canvas to create new health information, handouts and materials, and then, like I mentioned, the one on TikTok. We also created videos that outreach workers and folks could watch on YouTube about how to find reliable health information online. And one thing that kind of came about that we weren't really expecting, but ended up being a really great project, is we created a flip chart on applications and apps for cell phones that farm workers, that might be useful for farm workers. So like the OSHA app or like the heat safety app and different things. So the flip chart is like a piece of paper with an image on the front and then text on the back side of it. So it's kind of like a little tripod. And then the presenter can read the text on the back. It's in English on one side, Spanish on the other. And then the front has images. So you could just take this and present it anywhere. You don't need the internet. And then you just flip the top page over. And this is a common thing that's used for health education with farm workers. So we worked with the NC State Extension and created the content for this. And so that was like another little piece on digital literacy that we were helping with. And then the last thing regarding the internet and the hotspots with this program, um, excuse me. So this was with Student Action with Farm Workers, which is out of Durham, North Carolina. They recruited the Episcopal Farm Worker Ministry and NC Field, and they conducted some training with them, and they asked them what they needed, and they needed Chromebooks, headsets, and cases for those Chromebooks. They also got Vecinos and Sampson County Migrant Ed program to come on board with this. They were able to use grant funds to purchase laptops for youth in their Levante leadership program that they run. And then we also worked a lot with the NC Farm Worker Health Program, and they were instrumental in figuring out how to get hotspots installed at the camps themselves. And then the digital literacy videos were distributed by QR code. Apologies, I'm fighting off a little bit of a cold today. Okay,
No worries, Jamie. Take your time.
thank you, thank you. Sorry about that. It's been good so far, and now it's getting a little bit. Okay, so and the other thing is that we were able to have our grant partners participate in a new network, the NC State NC Broadband Network. So that was really aim 3 of the grant. Oops. Of course, we did a lot of dissemination of the different grant products that we were creating. So we presented at the NC Farm Worker Institute, the East Coast Migrant Stream Forum. We did a 2-hour workshop there. And then I also got to present at Ask the Doc COVID-19 updates and do a Finding Reliable Health Information presentation for community health workers at that. So there were a lot of really cool presentations and events we got to attend as well to help disseminate all this work that we were doing. Okay, so that is the end of my second part of the presentation. So I've got one more poll for you. So I'll go ahead and activate that. So if you want to put in what are some of the anticipated needs of the group you want to reach out to, or if you're not sure, how could you find out more about their needs? Yeah, this is looking really wonderful. So I love that the first thing that came up was just ask. It's like, yeah, definitely ask, do focus groups, do interviews, talk to leaders in the community. And then I see some of the big needs as transportation, health. All right, so I'm going to stop sharing this for now. Thank you all so much for participating in this one. So I know this is a lot of links, but I wanted to really share from the GO8 grant all of the information from today. So we have a website that we were able to create with the grant. It's called farmworkerhealthliteracy.org. We also have a dataverse. So the bibliographies I was talking about, that huge document with all of those 700 health outreach materials are both in the dataverse, as well as some health outreach materials. So if you're looking for some consumer health information materials for this population, please check out our dataverse page. And yeah, thank you, Faith, so much. We also created a COVID-19 guide for the farm worker population during the pandemic. And then there's also links to a bunch of the publications that came out of this grant that are linked here to PubMed. So where do I see, or where does our team see the future of the work going? I think there's always continual digital literacy and information literacy training that's needed, and that's where librarians are uniquely suited to provide those kinds of trainings for all different kinds of populations. In NC, definitely just what can we do to address the digital divide? That's going to always be a barrier to getting accurate, reliable health information, is the internet access, and for education and health and so many other things. Definitely, we noticed creating new patient education materials that are targeted to specific populations. That's just not something that's there, and certainly in other languages and indigenous languages, not, sometimes Spanish is the second language and English is the third. It's not their first language. So figuring out ways that we can help aid in that process of creation. And then certainly there's still a lot of areas to do community-based research with farm workers on information literacy, competencies and needs of farm workers and farmers, and what more can we also do to support rural public libraries. So based on that, and kind of identifying these future needs, we had a really good team. So we applied for a federal IMLS grant. It's a 3-year applied research grant. So the GO8 NLM grant was much more based on how do we address health disparities with information resources. This grant is much more conducting surveys, focus groups, interviews to find out more information. And so we received the grant. So we'll be working on this for the next 3 years. And it's a really unique grant because our library folks are leading the applied research efforts, but we're still working with NC State, with ECU Health and Human Performance, and our many of the same advisory panel members. So this just became a really huge thing, and we have a wonderful team. So we're going to keep this going and keep addressing these needs. So our new grant aims that we are working on since August of this year is determining the accessibility of online information by figuring out the prevalence of internet access specifically for farm workers, the devices that they have, and the average cost of internet access. The second aim, which I'm leading up this one, I'm really interested to know more about the information literacy levels and needs of farm workers, and we've included farmers, the growers and the producers in this grant, so that this can help us better inform library resources and programming when we're doing outreach to these groups. And lastly, we want to know more about, as we're kind of in our academic medical library world, we want to know more about what's already being done with the public libraries and to what extent they've participated already in broadband planning. And if they're not doing it, what are the barriers to that? And what can we do? What policy documents can we write to help them get more funding? So that's kind of the huge goal of this, is to produce more research, disseminate that out, and then also produce policy documents. So all this to say, all this work has been happening, but the first work was done with a librarian who was at ECU before I came, and I believe it was an NLM grant, and they did a smaller project, but it was still a really cool and important project. So please just start where you can. All of this is just because of other people that came before me. And I've been very happy to take up the work and keep going with it. I definitely will always recommend trying to find just a partner in your community that you want to work with and listening to their needs and seeing how you can support them. And if you work at an academic institution, just making sure to find out what partnerships are already there and see if you can become involved or involve the library in that work. And another thing that we've had a lot of success with is grant writing. We were able to get some CARES grant funding during the pandemic to buy and purchase laptops to give to the children of migrant farm workers who needed it for education. So that's something I can see libraries being very involved in, is kind of organizing that, getting that funding, and then getting that out to people and asking them what they really need. Tablets are great and all, but a lot of times we've seen people really need laptops and something more robust to continue their education. Other areas that you might want to become involved with, or maybe already are involved with, is anything having to do with internet access and supporting that, especially for rural areas. Training is always welcome and needed with different groups. The community health outreach workers have been so receptive to all the trainings, and they're always looking for trainings and webinars to do. And like I said, we're already, I would say a lot of us are very much instructional experts and very able to help clinicians develop new health education materials that are really tailored to specific populations. And again, with grant writing, you can write in money for translations and things like that. So I think, especially with the farm worker population, that's very much needed, is the internet access issues, but also looking for things that are tailored to the population. That could be like an excellent project. And then I think these are my last two slides, but just lessons learned. Obviously, being able to pivot, we've all had to do that with the pandemic. We had some delays with technology being delivered to us, and just redoing our training sessions to be online. I know I kind of gave some broad issues and health disparities with farm workers, but every single group and camp and place that they live or crop that they work with is different. So being able to work with the NC Farm Worker Health Program and the community health workers just really clued us into like all the different things that people are dealing with. And even within one population, you're not going to see the same thing for everybody. So definitely just making sure you're listening to the different needs. Um, and exactly, it's going to vary based on the location, the crops they're working with, the internet access varies by location, and then also languages spoken. And then the other thing I noticed was we've had really excellent translators throughout the project, but sometimes it can be in kind of that academic-y level and not more at the conversational level of Spanish that we wanted it to be translated into for the flip chart. So we also worked with people who spoke Spanish and then even from different countries so that we could get it into kind of a conversational level of Spanish for the flip chart, especially. Other considerations with technology, a big thing we ran into was, are we going to set up the devices or laptops for people before we give them out? Who's going to take care of them? Is that something we're taking on, or are we just giving them and then that's it? And then the last two things that I've definitely learned is that if you just have a great team, it's not work. It's fun, it's rewarding. It's one of the best parts of my job is getting to do things like this and do research. Um, and I never feel like it's just on me. But that being said, if you're a solo librarian and it really is all on you, anything that you want to do, however big or little or grant or no grant, it really, really matters. So you don't have to do some multi-year grant or anything like that. Just starting small or reaching out to an organization is just a wonderful thing that you can participate in. Again, I've linked some more resources here. These are a lot of the sites where we've gotten information off of on farm worker health, farm worker justice, Migrant Clinicians Network, the National Center for Farm Worker Health. These are all great resources to learn more about the population and health needs. And so for this one, just a little bit of last audience participation. If you'd like to share what your main takeaway is from today, if you want to just put it in the chat, that would be fine. Or if you have questions, I'd be happy to take any questions at this time.
While we're waiting for people to put stuff in the chat, I just want to say thank you so much, Jamie, for agreeing to do this work and coming on and just giving us some more information about this particular issue and how we can support people and the work that's going on. So, and we're getting some fire emojis.
Yes.
So that's one of the best emojis. So just looking at some of the things in here, great resources. People appreciate your soldiering through with the cold. The
I
flip
appreciate
chart.
all of you. Thank you.
The flip chart, asking who else is involved in this work. And I think that, lots of opportunities to make a difference in the farm workers' lives, which is probably the thing that's really the goal, right? At the end of the day, the impact there that you're attempting to do. So we'll open it up for questions. If you have any questions, please put them in the chat. I do have one question. I guess I'll kick it off for Q&A for anybody, but how are you or how are people measuring the impact of this? So is it like traditional outreach where you're like, we handed out 16 pamphlets or we reached 20 people or, so what? I don't know if that's in your work, but we do have to measure stuff. So I guess what are people looking to do? But then I'm assuming there's also quite a bit of qualitative work that goes on to this, right? Someone coming up to you saying, I got to do X, Y, and Z or whatever it may be.
Yeah, that's a great question just about the evaluation in general, and I'm glad that you asked that. We have a Dr. Leslie Kofi from ECU Health and Human Performance Department who does a lot of our evaluations, so that's really helpful for us. but a lot of it was conducting interviews with folks. For example, just with when we partnered with the Migrant Ed program with the CARES Act money that we got to give out those laptops to the children of folks who are migrant farm workers. They conducted interviews with some of the Migrant Ed folks. I think for us too, we would have liked to find out from the families directly, but I think in that case, we weren't able to contact them. But most of the time, it's like the evaluation is going to be based by interviews, and a lot of the interviews they've done through like WhatsApp and things like that. So we could just contact the farm workers directly, and not have to be in the same place at the same time because North Carolina has over 100 counties and it's a big spread out state. So when possible, doing interviews like over by phone or WhatsApp and things like that. Um, and then of course, like, you have your quantitative data and how many laptops were handed out and whatnot. But I really like when we can get that qualitative data. We're much more involved in the IMLS grant now with that, doing this applied research grant. But we did have an evaluator for the NLM grant who took care of most of that for us. So that was really wonderful.
Great. And another possible question is, I think you might have mentioned this in the lessons learned, but maybe if you could just kind of do that. What do you think are the challenges somebody should know before getting involved with this? You kind of mentioned the solo librarian stuff, obviously, which is a huge challenge. And I'm thinking in particular for rural hospital librarians in particular, because oftentimes they are solo. But any other kind of big challenges you think people ought to think about before getting directly involved?
I think one of the biggest challenges that I didn't really mention is because with this population in particular, people are moving around a lot. If they're seasonal workers, they might be like here working with one crop, and if they're migrant workers, they'll be here for the season and then they go back, or so that is tricky with the timing. And the best thing to do with that is that's where you really draw on the experience from your community partners to find out who's here at what time, what crop is happening. Like for example, we need some farm workers to help us pilot test an interview guide in December. So we're going to be asking folks from the western part of the state who are working with Christmas trees at that time and hoping that they haven't left yet. So there's a lot of timing, I think, with stuff like this, with research or outreach, where that timing can be tricky, and just, wanting to make sure that you work with the community partners. Um, and I think that's really it too, is just not assuming, like for me, I assume probably everyone's going to speak Spanish. Well, that's not the case at all. Like some people, that may be their second language. So just, yeah, just keeping those assumptions in check too and asking lots of questions.
Great. We do have one question in the chat. Thank you, Amanda, for your question. She says there's been a little pushback from farm focused groups. What advice do you have for librarians who want to do work that it might, let's see, advice do you have for librarians who want to do work that might spark controversy?
Yeah, I don't have like a wonderful, thorough answer for that, but I think just focus on the work at hand. Focus on things like internet access or the health disparities that you're trying to address. The work is not to say that the growers are doing anything wrong or bad. That's never been a part of the work that we've been doing for these projects. And we've certainly included that group of growers now in our new grant work, and how we can do outreach to them. And they're having the same issues with the internet connectivity and that they need that for their work. But I think for us, it's like health disparities. That's something all of us want to see addressed. That shouldn't be controversial whatsoever. So I think whenever it's happened like that, just moving back to that, this is a human rights issue to have internet to be healthy. And there's not a lot that people can say to argue with that, because that's part of the mission of ECU, even, is to serve people and to make people be healthier and live healthier lives.
Thank you so much. And We'll wrap it up here. It's 2:59. I'll give you guys back 30 seconds or whatever we have left before the top of the hour. Again, thank you so much, Jamie, for coming and doing this presentation. It was really informative, and I think a lot of people are living in areas where they actually have this population, or maybe they're just interested in working with this population. So we'd love to maybe hear from you in the future after you finish your IMLS grant, and you can give us an update on how things are going. And if you guys haven't seen it, please, I'll put it in the chat once again. The survey that will give you the the MLACE code when you're finished. And thank you all so much for attending and your attention and time today. So we'll be sending out slides and the recording once we make it available, and you'll be able to access those later. So thank you all so much, and have a great afternoon.
Thank you. Bye, everyone.
Great. Thank you, Jamie. If you'll stay on for a second, we'll let everybody drop off. Oh, and let me stop the recording.